So hello and welcome to the live Q&A, Ask a Simons Searchlight Genetic Counselor. My name is Curtis Weaver and I'm a Simons Searchlight Research Assistant, and I'll be hosting the session this afternoon. So you should be able to see and hear me on your screen. Although I won't be able to see or hear you and our genetic counselors won't be able to see or hear you, we're hoping that this session can still be interactive. So we're welcoming you to ask questions in the chat on Facebook if you're on Facebook, or the Q&A box if you're using the Zoom link. Please do remember, though, that if you're asking a question on Facebook, those questions are going to be public so other people will be able to see them. So we'd encourage you to avoid including any personal health information, otherwise known as PHI, just for the sake of your own privacy. So for those of you who don't know, Simons Searchlight is an ambitious research program with an international community of over 4,000 families. Simons Searchlight is aimed at creating an ever-growing database for scientists around the world to access valuable data on rare neurodevelopmental disorders. So we're growing every day, and we're so happy to have you be a part of this journey with us. So if you want to learn more about Simons Searchlight, you can visit our website, which is simonssearchlight.org. So Simons Searchlight has many genetic counselors who are on our research project and support our families. And today we're going to be hearing from two of them, Becky Smith and Jamie Atondo. Becky earned her Bachelor of Science in Biology with a minor in chemistry from Lebanon Valley College in 2017. She then earned her master's in genetic counseling from the University of Maryland School of Medicine in 2019. During her time at UMD, her thesis focused on the role of genetic counselors in the recognition and prevention of sexual abuse in populations with intellectual disability. Becky joined Simons Searchlight in 2019 as a genetic counselor, working with variant interpretation and interacting with families to help make meaning from and answer questions about genetic results. In her free time, Becky enjoys hiking, reading, and learning to play the cello. And Jamie graduated from Lycoming College with a Bachelor of Science degree in biology with a minor in psychology in December of 2018. She then attended the University of Pennsylvania for her Master's of Science in Genetic Counseling degree and graduated in May of 2021. Her thesis project focused on parental perceptions and opinions of their child's genetic testing for hearing loss. Jamie joined the Simons Searchlight team in 2021 as a genetic counselor, working on variant interpretation and helping families navigate the complexities of their genetic information and genetic testing results. While not working on Simons Searchlight, Jamie is a clinical genetic counselor in pediatric neurology. And outside of work, Jamie enjoys playing with her dog, reading, and traveling. So these are just two of our genetic counselors. So we'd encourage you to visit our staff webpage to read more about the other genetic counselors that work on this project with us. So in terms of today's goals, we're going to be answering questions that have been submitted about the role of genetic counselors broadly and also just within Simons Searchlight. We're also going to talk about what genetic testing is, what genetic testing results look like, how to understand them, and then what resources are available within Simons Searchlight and beyond. So we're now going to start with questions. We might not be able to get to all of the questions because we did get quite a few in advance, but we're going to do our best. To make this webinar as helpful as possible, as helpful to as many people as possible, we're going to be avoiding answering questions about very specific genetic conditions. And again, some medical specific questions related to procedures and treatments or other topics that might be beyond our expertise aren't going to be covered today. We're also recording the session, so if you miss it or you want to share it with somebody later, it's going to be available on YouTube, and we'll make sure to share that broadly. And we're going to go ahead and get started with our first question. So the first one I think is probably pretty, basic but broad, is what are genes and genetics? So I don't know, Jamie or Becky, which one of you would like to take a stab at that?
Oh, we both unmuted. Maybe I'll go ahead and get started and then you can follow me up, Jamie. All right, so when we think about genetics, we're thinking about our DNA. Our DNA is essentially our body's instruction booklet. It tells our body how to grow, develop, look, and learn, essentially how to work. And our DNA is spelled out in letters, exactly like words in a book are. Now, the letters of our DNA are supposed to be in a very specific order for our body to work like we could typically expect. Sometimes, though, those letters of our DNA can be changed, almost like a typo or a misspelling. And when that happens, it can change the way that our body reads and uses those instructions and can ultimately result in things like medical or developmental differences. So genetic testing is essentially working like a spell check for our DNA. It reads through those letters, see if there's any differences from what we typically see. And when we think about genes, those are specific sections of those instructions. So sticking with that instruction book analogy, a gene would be like a chapter.
All right, that's a really good explanation. I like the kind of analogies of calling it sort of like a book in chapters. I think that's really helpful. So you already kind of talked about genetic testing. So would one of you be able to kind of explain why a doctor, physician, or genetic counselor might recommend genetic testing?
Mm-hmm. So I can take this one. So a healthcare provider in general may recommend genetic testing for any types of medical symptoms or developmental differences that are going on. Different health institutions across the United States, across the world, are definitely at various points as far as their genetic testing practices. But in general, any child with autism spectrum disorder, developmental differences, intellectual differences, genetic testing would be warranted in them to really help guide their care and get to a reason as to why they have the medical differences that they have.
So then another question that is kind of related to genetic testing is if you guys could explain what
Uh-oh, it looks like on my end, Curtis is frozen. Are you seeing the same thing, Jamie, or is that on my end?
I am.
Oh, I think I just lost connection. I'm back now. Can you guys see and hear me all right?
Can see and hear you.
All right, sorry about that. So the next question was if you guys could explain what like pathogenic means, or like what is a VUS. So I think there's some questions coming in related to genetic testing in that aspect.
Absolutely. So as I mentioned with those letters of our DNA, we all have some gene changes. So if we did genetic testing for Jamie, for myself, for anybody at the grocery store, we probably would find some gene differences. And so what the scientific community is doing on the back end is researching as much as we can to help understand which of those gene changes are actually impacting somebody's health versus which of those gene changes aren't doing anything at all and just make us unique from one another. Depending on the amount of research we have and how well we understand different gene changes, we can get different classifications. So the first one you mentioned, pathogenic, that means that this is a gene change that we understand very well. There's a lot of research to help us be confident that that's a genetic change that likely is impacting somebody's health and development. If our research, though, doesn't get us to that point of being very confident, maybe we have some research that makes us suspicious of that gene change, but not enough, or maybe our research is conflicting. Well, in that case, we can end up with variants of uncertain significance, sometimes called VUSs, or inconclusive types of results. So those are gene changes that we usually tuck in our back pocket and keep learning about in the next couple years. As we get more research and as we can understand about that gene change more, at that point, we may in the future move it up to pathogenic, meaning we're more confident that's a piece of your child's answer. Or more research may come out saying, you know what, we don't think this is actually a part of your child's answer, and it may be downgraded to what we call benign.
So this next question I think is trying to get at maybe like how something gets classified one way or the other. So what makes something pathogenic versus a VUS? So like what information is actually used to classify these genetic variants?
As Becky was just mentioning a little bit about, we do have multiple databases that we typically will look through to help us better understand gene changes and to be able to better classify them. So one resource that is a really great resource that we use is called NOMAD, and not to get into too many details, but that is a population database of healthy individuals and their genetic information. So if we find a gene change we don't understand, we can look to this healthy population to see, has this been reported in other people that we think are healthy overall? If it has not, that could be a piece of evidence that it is contributing to medical symptoms. But if it is, or sorry, I said that the other way around, I'll keep going. Another resource that we looked at is in general, different scientific literature to see if there have been other case reports of patients with similar health concerns and that same gene change. If it has been reported before in people with similar health conditions, that would be another piece of evidence that it could be contributing to that health condition. We also use different prediction modeling tools that predict the effect of the spelling difference on the gene itself. So would it be expected to harm the gene? Would that gene be expected to be able to tolerate that specific spelling difference? So those are just a few without getting into too many of the nitty-gritty details of the different resources that we can use.
That's a really great explanation. And then, so I think this kind of is on course with what you guys were explaining. So these variant classifications can change over time. Can you guys talk like a little bit about that?
Sure. So our technology right now is really good at reading through those DNA letters, and we're really good at being able to identify any changes. But what we're still waiting on is for research to catch up to help us understand those different gene changes. And so over time, some of those databases that Jamie was mentioning really are going to continue to grow as access to genetic testing increases, as more families are able to have genetic testing. That will really help us understand these genes and specific genetic variants quite a bit more. So over time, we may find other children who have that very same gene change. There may be researchers who are interested in doing functional studies, looking at how that gene change actually is impacting how the protein is working and how our body is using that protein. So those are all additional things moving forward that can help us better understand a gene change over time.
So we had a really good question come in. So this person wants to know how can we know if there is a gene change? Like, is there a standard gene that we compare against to see if there's something that's different? Like, I guess, what is that, like, you know, perfect gene that you're comparing it to?
That's a great question. In general, I'll say that we have references and reference samples, and this is usually on the part of genetic testing laboratories that they are comparing their patients' genetic data to see if there are any spelling differences. And when we speak about spelling differences, as Becky was saying in the very beginning, we have some that we would not expect to impact the gene. So some benign variation that doesn't cause a difference in the protein that's made, basically. So it's really on the job of the genetic testing laboratories and their sequencing technologies to be able to call out any gene changes that are different from the typical that might be harmful to the body.
So then I think this next question kind of gets to the root of things in a way. So like what even causes genetic changes to happen?
That's a really good question, and one that so many families have and ask. And there isn't anything that anybody does or doesn't do that causes these totally random gene changes. They're absolutely by chance differences that sometimes just happen, but it's nothing that anybody does that causes them.
So then the next set of questions are that are coming in are around gene therapy. So what is gene therapy? Are there other personalized medicine treatment options that are being developed right now? So if either of you guys could speak a little bit about that.
So gene therapy in general is a really exciting new frontier and is potentially a way to change the genetic differences that we're born with. There are some different technologies that gene therapy is being explored with. So some ideas, without to get too much into detail, is to use different types of messenger molecules to actually change the spelling difference that's underlying the gene change. There are other more indirect ways of gene therapy, so ways to either upregulate the resultant protein or downregulate it, so either making it more abundant or less abundant in the body to change its effect to the body and then therefore health. Gene therapy is in its infancy for many genetic conditions, which is why research projects and initiatives like Simons Searchlight is so excited about this potential in the future. But at this point, we do put the disclaimer that it is in its infancy. But that's why we like participating families like many of you guys.
And then I'm not sure, you mentioned that gene therapy is kind of in its infancy. Are there any other treatments or interventions that we can do now based off of somebody's genetic testing results?
Well, that is certainly the goal and where we hope to get as a field. Right now, the majority of results rather help give us a sense of understanding. They help us know why a child may have specific developmental differences, and they can help us guide care moving forward. So if we know specific features are associated with changes in specific genes, well, then we can proactively get that child to those specialists to make sure we're taking the best care of those children as possible. Sometimes we also find that specific behavioral interventions, for example, may be particularly helpful within specific gene groups. And so that's where connecting with other families can be really helpful, to reach out and say, we're really struggling with this right now. Has anybody else faced this? What worked? What didn't? And families can find a lot of utility there. Ultimately, if we can understand how these gene changes are impacting the protein, the goal would absolutely be to fix or supplement or correct what that gene change is doing. And so very long term, I think at this point for many of the gene changes that we're studying, but the goal would be, maybe if that protein is broken, we could supplement with a different type of protein. Or if that gene change is making the protein work in a way that we would not expect in a brand new way, well, maybe we can fix it back to what we would expect, or we can stop that copy that's working in a different way from working at all. So that's generally what the field is hoping for and aiming and investigating. But right now, not quite next steps after many families get back a genetic diagnosis.
So then another parent just asked, why were they asked to provide a sample for their child's testing? So what do their results mean in the context of their child's testing results?
Mm-hmm. So in essence, parents are really good comparison samples, because we would expect that first degree relatives to any child, so parents, siblings, and then ultimately down the road, their children, are going to have about 50% of their genetic information in common. So many genetic conditions can be brand new to a child. So they can be the only ones in their families with that genetic condition or that gene change. So often when we're doing genetic testing, it's just really helpful to have parents as reference samples to say, how is this child different from a genetic perspective than their parents? Some gene changes that we see are inherited. So in that case, it would be helpful to have a similarly affected parent's genetic information to be able to say, what is the common link that might be causing this child as well as this parent's, learning differences? Maybe both of them have seizures, things like that. So really in either scenario, having parents or other family members, if parents aren't available, to be able to compare that child's genetic information to can be really helpful for finding out their genetic answer.
Another question that we just got is, I guess more so they're saying, what do we do next? We just got our genetic testing results. We still have some questions like, well, what do we do next?
Well, being here is a great next step to begin with. I think taking time to process what this information means, not only in terms of what does the actual information mean, but what bigger meaning do these results hold for your family? Does it change your day-to-day? If not, that's totally okay too. Does it change what you think about long-term? And so working with your provider to understand these results is a great first step. If your provider has some questions too, saying, I want to keep learning about this result, engaging in research is a phenomenal way to keep learning information, to contribute to the field learning more information, but also to be informed and get feedback right away as we're learning. You can also connect with other families. So like I mentioned a couple minutes ago, being able to talk to other parents whose children have these same gene changes often builds a sense of community and understanding, and is a really great resource as additional questions come up.
Yeah, and mentioning sort of support groups, that's a really good point. I know within Simons Searchlight, we actually have Facebook groups for all of the genetic conditions we study, but even if you're tuning in and you don't have a genetic condition that's on the Simons Searchlight study list, there's likely a Facebook group out there somewhere. And there's a lot of really good interaction that happens there. So this next question is kind of, I guess, almost, what happens if we've done genetic testing and we don't find an answer? Does that mean that there is no genetic reason for developmental differences in my child or myself?
Mm-hmm. Yeah, so for genetic testing in general, there are so many different types. There's genetic testing that can look to see if all of the chromosomes, which are the larger structures that house our genes, are there. There are genetic tests that look specifically at any deletions or duplications of genetic material. So is all the content there? There are genetic tests that read through to see if there are any spelling differences. We could continue to go on and on. So sometimes when a child is being worked up from a genetic perspective, it can take multiple steps and different types of genetic tests to actually get at their genetic answer. Other times we do our most comprehensive, our most extensive genetic tests that we have available to us, and we still don't find a child's genetic answer. And that's really just because we're still very limited in our genetic knowledge. We do know a lot, and of course we've made a lot of progress, over time, but there are still children and families that we see that we're highly suspicious there may be a genetic cause going on for their medical differences, but we're just not able to find it. And that's really just because we're very limited in our knowledge. So just because a definitive genetic explanation is not found through testing, we can never fully rule out with 100% certainty that there is no genetic contribution.
And would you say too, so I know some families might have genetic testing that was done a while ago. It's possible they might have a result in the future, even if they don't have one in the moment.
Yes, that is a very great point, and I would certainly agree with that. As our technology is getting better over time, as our genetic knowledge and our ability to interpret the gene changes that we find improves over time, it's possible that someone that had testing maybe only 2 years ago could get updated testing today and it could find a genetic answer.
So this next person says, we found that I also carry this gene change. So I'm assuming this is a parent. What are the chances that other people in my family also have this genetic change? Can I control passing this on to other children that I might have in the future?
That's a great question and a big one. Lots of different components there. In general, when we find that somebody has one of these types of genetic variants or gene changes, we say that there would be a 50% or 1 in 2 chance that any of their first degree relatives, so parents, siblings, or their own children, would also carry the same gene change. And just like it's nothing that anybody does or doesn't do that causes these gene changes, we don't have any control over DNA or if our DNA has any spelling differences in it or what DNA we pass on to our kids. That is a similar, totally random by chance process. That being said, if people are interested in testing, oftentimes taking a copy of that genetic testing report for a family member to their primary care provider, their doctor, or pediatrician can be a really great place to either get testing through them or they can place a referral to genetics. There is some prenatal testing that's available, and depending on the different genetic, the specific change found within your family, there sometimes are also preconception options, but a great conversation to bring up with your genetics team specifically so they can get your family connected in the best way.
So then if somebody does get a genetic result, maybe it's their child, how can that parent expect that result to affect their child's health care?
Mm-hmm. So if they get a genetic diagnosis, then it can be helpful in terms of providing information about other body systems that may need to be monitored. So for example, if a certain syndromic diagnosis, we may also expect to have heart involvement, but that child has not been yet evaluated by a cardiologist. Getting them plugged in with cardiology can be really helpful to make sure that they're getting taken care of from that perspective. So just making sure, giving us some information about other systems that may be really important to monitor for. Genetic results can also be helpful in terms of sometimes prognosis information. So a lot of our gene changes that we study have epilepsy as a common feature. There are some genetic epilepsies that we know are prevalent in a certain period of time, so maybe only in infancy or in childhood. So to give your family that information as to what we would expect moving forward can sometimes be a part of their genetic diagnosis.
So then this next question, I think we've kind of covered it a little bit already, but somebody wanted to know, how do we fix gene changes that are identified?
So that does go back to the idea of the gene therapy that we've been talking about. So at this point, there's not really anything that we do clinically to fix those gene differences. We use those identified changes to help us understand a child's history and to guide care moving forward. Ultimately, though, with things like gene therapy, that's when we get more into the idea of, if we can correct the gene change on the level of the DNA, does that affect downstream health and development?
So then this next question is, how do doctors know what signs and symptoms are related to different gene changes?
So in general, doctors do go through extensive medical training, and more specifically, sometimes people have access to medical geneticists that are doctors that are very well versed in genetics, different syndromes, different gene changes that are more common. So medical geneticists and as well genetic counselors like Becky and I just have very thorough training in genetics and genetic conditions. And we, during our training, get background information about syndromes and different features that are much more common within a certain syndrome or a different gene change. And some doctors and genetic counselors are fluent enough in this area that they're able to, look at a child and kind of guess their genetic diagnosis. And if they're fluent enough, if they're very good, they could, potentially be able to diagnose a child based on their features that they have.
This next question here kind of switches gears a little bit. What does participation in Simons Searchlight entail? And I'm sure you guys can really speak to this from like a genetic counseling perspective and have a lot of insight there.
Sure. So when you register for Simons Searchlight, one of the very first things that you'll be asked to do is upload a copy of your child's or your own genetic testing report. At that point, it'll come directly to Jamie and myself and a team of genetic counselors who reviews those testing results. We look at all of those databases that Jamie mentioned to help us understand this specific genetic variant. We collect a lot of information and store all of our information in very systematic ways. From there, we'll ask your family to complete many surveys and a phone call where we learn all about yourself and your child and your family. Again, collecting a lot of information about your medical and developmental history. At that point, on the back end, we compile all of this information. We share this research back out with the general scientific community, and we also partner with external researchers who are interested in also better understanding these gene changes. Putting together common features that we see among all of our families within these different gene groups helps us, helps scientists, and helps doctors best understand what those different signs are associated with these different gene changes. And so that was a very long-winded answer to say we will ask you to collect a lot of information about your histories, but that does help us in the field better understand these specific gene changes.
And so I think you were already getting at this, but somebody asked, why is attending a medical history interview so important? So I'm assuming they're talking about the medical history interview within Simons Searchlight. And that's also something that's done by genetic counselors on the team. So could you guys speak a little bit about that, why that's so important?
Yep, so there are other genetic counselors that work on our team that are not here today. So we'll definitely give them a very large shout out for being another really important integral members of our team. But they do conduct the medical history interviews with our families. So that is a really in-depth opportunity to be able to talk with a genetic counselor one-on-one, to be able to dig in more, get more of those details as far as your medical history, developmental history, family history, all that good stuff that we wouldn't otherwise be able to capture on a generic survey. Of course, our surveys are so helpful in terms of getting the same information from all of our families that participate, but the medical history interviews are just very important for getting much more thorough information and also just being able to talk with someone on our team. Becky and I hear from our other genetic counselors a lot of many really great questions that people may have that could bring up the opportunity for them to connect with us later on the back end and talk through any other questions that they may have. So we always encourage all of our participants to make those appointments, to keep them, to show up. And it is just such a good opportunity to be able to connect with one of us one-on-one.
So another question that just came in is, what are the costs associated with genetic testing, and does Simons Searchlight help out with this?
That's a wonderful question. So cost is so dependent on where you're located, the type of testing that's being offered, your child's history, the hospital you're being seen at. And so unfortunately, as much as I want to, I cannot just give you a flat answer with cost there. It also is dependent on where you're geographically located and the type of insurance or healthcare system that you're operating within. And so to get a better answer for that question, I would absolutely reach out to your healthcare team. They'll be the most familiar with the resources and options available to you and can help you get an idea of that cost. I will also say that there's no cost at all to participate in Simons Searchlight. And so, while Simons Searchlight is certainly a research entity and different than clinical testing, so they hold different roles, we don't want cost to be a barrier to any family to engage in research.
So then could you guys talk a little bit more about what resources Simons Searchlight provides families?
Mm-hmm. So at our website, simonssearchlight.org, we have so many different resources for all of our different genes that we study. So if you can go to that website, if that's helpful, I believe at the very top of the bar, it's research and then genes we study, and that will link out to all of our different gene changes. And then within each of those hyperlinks, we have gene summary pages that we'll link to, that will link out more common health concerns that we see among people that have that gene change. We also will link out more recent research publications of patients' families, different case reports, to give some more scientific information about those gene changes. We have family stories. So some of our families that will come forward and share their story as far as their genetic diagnosis, what their child is like, how their family is like, how they interact with the world, around them. We have all of that good information on our website. In addition, as Curtis was saying earlier, we do have gene group Facebook pages that parents are able to connect with each other and, caregivers, support people, all of those kinds of different people, just to get ideas, to share hardships, to share victories that they've been through. So it's a really nice way to be able to connect with people.
And then just thinking about, because we do study a lot of different genetic changes within Simons Searchlight, could you guys talk a little bit about the difference between like copy number variants and single gene changes? Because if anybody looks on our list, sometimes there's numbers associated with the conditions and other times it's just kind of, more standard looking gene. Could you guys talk a little bit about that?
Sure. So those are different types of changes that we can see depending how we're looking at the DNA. So with copy number variants, those are thinking about deletions or duplications. So missing or extra sections of our DNA. When we find those, we largely name them by where along on our DNA they're located. So it'll often start with a chromosome and then a string of letters and numbers afterwards that essentially work like a roadmap to tell us where along that chromosome that deletion or duplication is typically located. When we think about single genes, that's actually zooming into the DNA even more to read through those individual DNA letters. So oftentimes when we're thinking about single genes, those are much smaller spelling differences that we're finding compared to those extra or missing pieces. And so identifying which group your family fits into, oftentimes you can look for which piece matches what you see on your testing lab report. Or if you need some help, always send us an email and we're very happy to take a look and help you get to the right home.
And since you shouted out our email, I'll just make sure I say it really quickly. Our email, if you ever want to get in touch with any of us at the Simons Searchlight team, is coordinator@simonssearchlight.org. So another question that just came in is, and I think we've kind of talked about this a little bit with some of our like Facebook groups and things, but how can I get connected with other families who've shared the same genetic diagnosis as me or my child?
I would certainly agree with encouraging the Facebook groups is a very accessible way, you know, as long as you have internet as a platform to be able to connect with other families one-on-one. We are also hosting in the summertime a number of different family meeting groups in which people from the same gene change are able to meet with each other, potentially in person. There will be virtual platforms as well for people that cannot attend in person, but those are just a couple of the great opportunities that we have for families to be able to connect and share ideas, share stories, all that good stuff with each other.
So next question that came in is, what is cascade testing?
Cascade testing is the fancy term that we use to describe testing other family members. So if we find that a gene change is inherited from a parent, well, then we may do cascade testing for their other children or the parent's siblings.
So next question is, where can I find the best information about my genetic condition or my child's genetic condition?
Mm-hmm. So there are so many different resources available online. There are also books, depending on the specific gene or gene change, that can be helpful for parents and family members to make sense of their child's or family member's genetic result. We also definitely would encourage families to talk with their healthcare providers that gave them that genetic diagnosis, as they're going to be a really helpful resource to help dilute down some of the really clunky scientific language that can be out there more broadly. But if healthcare teams, need help finding some of those genetic resources, some names of databases that Becky and I use all day, every day, could include things like Gene Reviews is a really good spot to get summaries of gene changes. The Unique Guidebooks resource online is a really good, more patient-friendly way to have access to guidebooks that are great summaries of different gene changes. And then also, as we mentioned previously, our website in general and all of the different linking out that we do to our gene summary guides, to publications that could be helpful for families. So all of these resources are going to be your go-to.
So then some of the questions that are coming in, I think some of these are very specific to particular genetic conditions. So we'll try to generalize that in our responses just to make it as accessible to everybody. So one question is, are there currently any vitamin or mineral recommendations? And they didn't actually list a specific genetic condition, but I guess in general, is it, if somebody has a genetic condition, are there ever like vitamin or mineral recommendations for supplements or anything like that?
So as an overarching answer, thinking about all different types of genetic disorders, The basic answer is no. There's not a specific supplement or vitamin that would be recommended. At this point, I would encourage you to go back to your primary care physician or your genetics doctor, who would be able to think about your child's specific result and in conjunction with your child's own medical history. Medication recommendations use many different pieces of the puzzle to make sure those doctors are recommending the right thing. And so combining both details of the genetic testing result, what we know in the research, but also your child's own history, those clinical providers are the best people to make those recommendations for your children.
Thanks, that's a really great answer. So this next question, somebody asked, is there something I should have done to get her tested? I'm assuming she means her daughter, her tested sooner. She was 16 by the time we got her diagnosed.
So I'll say in general, families, hospitals, healthcare providers definitely have a very variable timelines in terms of having access to genetic testing. So sometimes children are a little bit older when they're getting diagnosed, and that is at the fault of nobody. It's not, parents for not seeking it out sooner. It's not the doctor for not offering it sooner. It's definitely a natural feeling to potentially want to put that blame on yourself that you should have known sooner. But we would absolutely not encourage that and say, just applaud you for getting access to genetic testing when you can. And we're all doing our best as far as, parents, hospitals, healthcare workers, to be able to provide genetic testing to families in a meaningful way to be able to change their care.
So then talking about genetic tests in particular, somebody wanted to know if there's a genetic test to know if there is a gain or loss of function in a genetic condition, or is that just based off of the symptoms that the patient has?
That's a great question. So one of the first things that Jamie and I think about when we see a genetic change is we try to understand how that gene difference is affecting how the protein is working. We have a couple of different vocab terms that we use to describe that effect that you mentioned. So when we think about loss of function, that would be if the protein is breaking and not working anymore. When we think of gain of function, that's when the protein is working in a new or novel way than we typically expect. Now, when we find a DNA gene change, there are some clues we can use to try to answer that question. There are specific variant types that we know are more likely to lead to loss of function versus gain of function. Sometimes we can use a child's medical or developmental history to give us clues. Sometimes loss of function versus gain of function can show us different medical signs. Sometimes scientists can also do what we call functional studies. So that would be looking at specific cells to see how this gene change is actually affecting the protein. So these are all different pieces of the puzzle we try to use to best guess whether a specific gene change is a loss of function or gain of function. And depending on what gene that change is located in and what the specific spelling change is, we may or may not be able to fully answer that question right now.
So then somebody wanted to know, what are the differences between epilepsy panel tests and whole exome sequence, and actually maybe if you want to add in some of the other kinds of genetic tests that are out there.
Mm-hmm. Definitely. So in general, panel genetic tests, including epilepsy panels, are looking at genes related to a specific health concern. So for example, the epilepsy panel looks at, depending on the lab that you go to, probably a couple hundred genes we know of that are primarily related to epilepsy. Now, within those genes, they can have association of epilepsy plus autism spectrum disorder, maybe plus developmental differences. But the primary reason that all of those genes are on that epilepsy panel is because they all have an association with epilepsy. There are other types of genetic testing panels out there. So for example, types of panels that look at genes related to cancer, certain panels that look at genes related to heart disease. So all types of panels, those are more focused genetic tests. To speak just briefly about Curtis's point of other types of genetic tests, there are genetic tests called karyotypes that can count the number of chromosomes that someone has to assess for total genetic material. There are genetic tests called microarrays that look for any missing or extra genetic information. And then one of our more comprehensive genetic tests is called whole exome sequencing. So that test, rather than just focusing in on a group of genes related to one condition, such as epilepsy, it would look across all of someone's 20,000 genes to see if there are any spelling differences. Certain whole exome sequencing tests can also look to see if there are any missing or extra pieces of genetic material. So it really depends on the specific test whether or not that type of information is assessed for. But just some of the differences there with different types of genetic tests that we see.
Then another person asked, to what extent is information available for schools to help strategize on how to best support the needs of a student in our schools who has, in this case, they were talking about a 16p11.3 deletion, but really I think that's kind of applicable to any genetic condition.
What an important piece of the puzzle for so many different families, no matter what specific genetic test change we're thinking about. You know, I think some of those family resources are really great things to share with those schools. I think it helps teachers understand why a child may have specific behavioral or learning considerations. You know, working very closely with the school for things like individualized education plans or learning supports. Those are the things that really can best help set your children up to succeed, capitalizing on the strengths that they have, but supporting them in the areas that they need to. And so a lot of family-friendly resources are good to give. Partnering with your pediatrician, looping in your genetics team. Many offices may have specific professionals who are able to come with you to those IEP meetings to tell you these are the things that are really important for you to advocate for, and to help you meet in the middle in terms of the things that the school is advocating for, what your healthcare providers are advocating for, and what you as parents are advocating for. And so it's absolutely a team effort, not only in terms of resources, but the actual people involved in those meetings as well.
So here's a really good question. Can you tell me why two kids from different families have the same genetic condition but have so many different effects from it? For example, one child has severe epilepsy whilst the other one doesn't have epilepsy.
We certainly agree with the sentiment that you're expressing here, that, you know, children that have potentially exactly the same genetic change can present very differently in terms of the symptoms that they have, the severity of those symptoms, the age of onset of those symptoms, so many different factors. And although at that point, it seems like we're recognizing that those two individuals have the same genetic change, they also have 19,999 other genes that are playing into their body and their different medical symptoms. So we tend to really focus in on one specific gene change causing so many different potentially, health concerns, but there are so many other factors as far as all of their other genes, their environment that they're around, just a lot of other variables that contribute to all of those things: severity, age of onset, different health concerns. So there's just a lot out there that we still don't understand.
So this next person says, my child has a genetic condition that's more likely to affect males, but has been labeled pathogenic for her. So does that mean that could be causing her delays?
That's a good question too. For conditions that we think affect males and females differently, it's likely that that gene change may be on the X chromosome. So flashback to your high school biology class, you may remember that generally females have 2 X chromosomes while males have an X and a Y chromosome. So because females have a backup X chromosome to work, if one isn't working like we would expect, that means that males and females can show us different signs of these X-linked conditions. I also want to zoom out a little bit to distinguish between a variant classification and clinical significance. So that pathogenic label that you talked about is that variant classification. That's using all of the research that Jamie and I do on the back end to understand how that gene change is working within the body. It's really important, though, to remember to always think about clinical significance, that other piece of the puzzle. And that's where your healthcare providers are so important. So while we can look at a genetic testing result on paper, we want a clinical provider who's able to think about your medical and developmental history, who's able to do a physical exam, and who can review other labs that you've had, like blood work. They'll look at all of that information and try to make sense of it in the context of this genetic testing result. And so in results like this that may be X-linked, a pathogenic gene change is likely affecting the health of males in the family much more than it is affecting females in the family.
So this next question kind of harkens back to some of the things that I think you guys have already talked about. Is it possible to correct the spelling mistake in a gene? But then they bring up another point about stem cells. Are there anything that like stem cells can get involved with? I know we've already kind of talked about gene therapy, but do stem cells have a role to play? Is that different? Is that the same?
I think at this point, we do not know of stem cells being used to help correct any types of underlying genetic differences or to be able to change the symptoms that a child may have. So, correct any intellectual or developmental differences that they have. But I think that's an exciting area of medicine that will probably be explored further in the future.
I just want to say these questions have been great, but we probably only have time for a few more. Let me see here. So another question that we just had come in recently was, we were told the spelling change was at 720 milliseconds. What does that time signify in tests?
I'm not sure. Hearing a specific time like that, I'm not entirely sure what that is getting at. I will say that sometimes when we see numbers like that on a specific report, it's essentially like a roadmap again. It's telling us where exactly gene changes may be located. So it may be helping us understand the specific gene change that was found in your child. But that being said, I would be very happy to look at it specifically to make sure we're giving you a personalized answer based off of the information you've been shared. And so I know Curtis previously mentioned our email. Absolutely feel free, and we're happy to take a look at your individual report to get you a better answer.
And then just a reminder too, that email is coordinator@simonssearchlight.org. We had a follow-up question. So we talked about the school system a little bit. So it sounds like this person's actually a school rep that's trying to learn more about this child, and they're wondering where they might find additional reports and resources so that they can get a better idea of how to support that child in the school.
That's a great question. And thanks for tuning in as someone that just wants to learn more to be able to better support the students that are around them. So in general, for healthcare providers or people that work within the school system, a really good resource that is going to be helpful in terms of providing specific recommendations or resources that could be helpful would be gene reviews. It could be a little bit clunky from a medical perspective, but definitely could be a good resource to start out with. And then also on our website at our different gene guides that we link out, as well as the unique gene pages and summaries, are more of a lengthy resource that could be potentially helpful to read through to get more family, school friendly related materials to look at.
All right, thank you. That's a really great response there. And it's really great to see people that might not even be directly affected by a genetic condition tuning into something like this. So we really like that. I think we'll do probably one more question. We'll probably try to wrap up. So unfortunately, we're not going to end up covering everybody's questions, but I just want to say, give a shout out to everybody that's attended because these have been great questions. So I guess for the last question, it might be a little bit of a complicated one, but we'll see. Is there any work being done to understand how one genetic condition, for example, 1Q2 1.1, interacts or is influenced by other copy number variants?
Yeah, that's a great question and something that the field is thinking about a lot. We think that understanding all of the different pieces of the puzzle to help put them together for a child to explain the full picture of their history is really important. You know, depending on the type of testing that was done, it may have only been looking for a specific type of gene change, like deletions or duplications, not those smaller spelling differences. And the more that we do genetic research, we're finding that people have a lot of different genetic changes. And so even though we found one piece of the puzzle for them, it's totally possible that there are other pieces as well that are also contributing to their health and development. And so I think in the coming years, that'll be a pretty prominent area of research in the field and trying to understand, you know, which features of somebody's history is fully explained by this one gene change that we know, but also what other parts and pieces of their 20,000 other genes are also impacting their health and development. So definitely something to stay tuned in about. It's something that we hope we can tell you a lot more about in the coming years.
All right. Thank you so much to everybody who's asked a question today. These have been absolutely great. And also thank you to those who have supplied some questions in advance. So we'd obviously like to give a huge thank you to Becky and Jamie for joining us today and everybody who attended and shared their questions with us. So kind of as follow-up, if you wanted to learn more about Simons Searchlight or registry or how you can get involved, please visit our website, which is simonssearchlight.org. And you can always email us, like we've mentioned already a couple times in this Q&A. Always email us at coordinator@simonssearchlight.org. Our genetic counselors, Becky and Jamie, for example, are happy to address any specific questions you might have about you or your child's genetic testing report or result. So thank you again, everybody, for tuning in today.